Hello friends, welcome to Creative Medicine. In this lecture, we will learn about a patient is brought with 6 months of history of odd behavior. There is history of a family member having disappeared some years back. He seems to be talking to himself and sometimes laughing loudly. The likely diagnosis is there is odd behavior, which means the patient has disorganized behavior. Then there is history of the family member who has disappeared some years back. So this can account for family history of mental illness is present in the family of the patient. Next, he talks to himself and sometimes laughs loudly. Talking to himself and laughing loudly may be due to some hallucinations that the patient is having. So, hallucinations, disorganized behavior, mental illness, all these together are seen in schizophrenia. So, this is the symptom of schizophrenia. Thank you and thank you for watching.